This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Ready? All right. Well, good morning, everyone. Just wanted to talk about a couple of things heading into today's session. Obviously, it's happening in the context of the state budget debate, consistent with the actions taken by legislative Republicans on the budget. We continue to see decisions being made that are counter to not just the governor's proposal, but the will of the state of Wisconsin. We know that there are a number of issues that were included in the budget that have been removed. We know there are a number of decisions that are being made that are counter to both the needs and the priorities of people of Wisconsin. Yesterday was about lead pipe abatement. And we know that a lot of the things scheduled today are consistent with the fact that we've got a majority that's attempting to govern on priorities that are out of touch and not consistent with where the majority of the state of Wisconsin is. We've seen today's playbook before. If you remember, a year ago, January 16th, Patty Shockner won the special election in Senate District 10, and just 2 days later, Governor Walker reacted with a package of, quote, welfare reform bills that had never been discussed before, that were sort of the red meat for their base and also a distraction from were sliding polling numbers and enthusiasm on the other side to try to hold Republicans accountable. Sure enough, April 10th, the Marquette poll comes out showing overwhelmingly support for Governor Evers' budget, including 70% support for Medicaid expansion and significant support for his medicinal marijuana proposal, also included in the budget. Just a little later that day, Republicans began rolling out a four-part extreme package of abortion legislation that's before us today at a time when, as my colleague Evan Goyke said last week on finance, they're losing. That's why we're seeing these issues come up today. They're a distraction from the budget exercise and the lack of support for the bills or the priorities of the governor and legislative Democrats in Wisconsin right now. So we know we've got a couple of other bills up today. I will be happy to take questions. I'll say this. The reason we keep coming back to the Medicaid expansion is because it is the pillar of so many things in the budget. You may hear weak explanations for the bill supporting reducing the training requirements for certified nursing assistants today. I'll remind you that the governor's budget proposal with the Medicaid expansion, the $1.6 billion that we draw down, includes $154 million for nursing homes and personal care workers. So if we know Medicaid reimbursement is the big issue impacting nursing homes throughout the state, there's a great way to do that, and they've already rejected that, but they still have time to get it done. If we really want to have that discussion, let's do it. So with that, happy to answer any questions on anything.
Republicans are introducing a bill that would make it easier to get birth control. What are your thoughts on that proposal? Have you seen that proposal? Would you support that?
Well, let me tell you, it is. It's certainly, we support access to increase access to birth control because Republicans have done everything in their power to make it harder to get access to birth control. 5 women's health clinics were shut down because of them that offered birth control in rural parts of the state that were never replaced. So we are looking at this proposal very, very closely. If we determine indeed it does support women getting access to birth control, obviously that's something we're very supportive of. But this is not something we have seen. Let me be very clear. We have not seen in my tenure here one thing from Republicans that support access to birth control. They have gone after it at every opportunity. They have shut down clinics. They have defunded one of the state's number one provider of birth control. So that is, they have typically really, really gone after women's access to birth control and made it much, much harder. So we will look closely, though, at this proposal.
I'll just add that, I understand there's some age restrictions and some other things in there that have, if you were really going to design a bill, wouldn't be probably how you do it. I know Representative Sargent's been working on something like this for some time. That, my guess is will be a better version with more input from groups that are out there. I think the timing can't be lost on us. It almost seems a little defensive, perhaps, from some of their members, given the agenda that they're pursuing, not just in Wisconsin, but nationally.
Republicans say that the Born Alive abortion legislation in the election is controversial. Are Assembly Democrats going to support it, oppose it? If so, what's the rationale?
Well, I'll remind folks that Republicans had 8 years to push their things, and I told you about the timing of this legislation after a poll was absolutely rejecting by an overwhelming margin the priorities of Republicans in the state budget. I think we know that if we are serious about doing everything that we can to reduce our high infant mortality rate, especially among low-income and minority populations, and support good maternal health, there's an easy path forward on that, and that is to support the Medicaid expansion. There is no health benefit to any of the things that we are seeing today, which is why the Medical Society and the American Congress of Obstetricians and Gynecologists opposes their bills.
And I just have to ask, if Republicans were truly committed to saving lives, they would have expanded Medicaid. We have 82,000 people in this state who could have had access to life-saving health care. The vast majority of these people don't have any health insurance. We know in that population there are people who have underlying health conditions that probably are going to kill them without access to health care, without access to health insurance. Republicans have refused for 8 years to make investments that save our state money, that attract billions of federal funds and save people's lives. And they turn their backs on the people of this state once more in refusing to take millions or billions of federal dollars and save millions of state monies and save people's lives. They refuse to do it. They'd rather people die than expand access to Medicaid.
So on AB 179, then, are Democrats going to oppose that?
I think that's the case.
How do you think this Born Alive bill fits in with what we're seeing in other states on reducing the number, like Alabama last night, Missouri's got another bill up today? How do you see Wisconsin fitting into that national narrative?
I'll say this. The news in Georgia and Alabama is absolutely chilling, and we also know it's inconsistent where the majority of the public is nationally, not just in those states. We've already seen an impact on the health because of decisions made in Wisconsin over the past 8 years. Clearly, it's following the same playbook where they're going to, pander to some of their own groups. They're going to try to distract and create some of these false narratives. Nothing was more disgusting than President Trump coming to Wisconsin and repeating a refrain that is not only not true, but it's sick and disgusting. We owe it better. I think we all feel that we trust physicians in the healthcare community. Someone whose wife is expecting, I want those decisions made by us and our doctor. It's kind of chilling what's happening nationally, including in Wisconsin.
I just want to say,
Yes.
I sit on the health committee, and I had the opportunity to ask Dr. Hartke how all these decisions we make affect how a physician or a provider goes about giving health care to the woman in her pregnancy. And it's putting a chilling effect. As we speak, there are mothers in this state that are going to have lawyers come in the room and make decisions for them. There won't be allowed palliative care for the catastrophes that might happen during a pregnancy. All these bills have a chilling effect on the adequate and appropriate care that physicians and providers should give to their patients. And talking about Medicaid expansion, there's a JAMA article in April that talks about a look at 15 million pregnancies and the outcomes. And states that took Medicaid expansion had a better rate, had decreased the disparity of children of color in their infant mortality rates. Those are the things that talk about what we can do to save infants.
Again, that was Representative Colsty, who chairs our health committee. So, any other questions?
All right, thanks.
All right, thank you.